Hello, Bob54. My name is Daniel, and today I'll be covering skin cancer for you guys. So let's get started. So what is skin cancer? First of all, in order to answer that, cancer, the definition of cancer is the uncontrolled growth of abnormal cells. So skin cancer is the uncontrolled growth of abnormal skin cells. Could you believe it? So skin cancer occurs when unrepaired DNA damage to the skin triggers mutations or genetic defects that lead the skin cells to multiply rapidly and form malignant tumors, which is not good. So today I'll be teaching you how to be aware of these uncontrolled growth skin cancer symptoms by explaining how it works, what to look out for, as well as what to do if you spot any of these signs and symptoms, which I'll talk about later. So there's three common types of skin cancer, which are basal cell carcinoma, squamous cell carcinoma, and just melanoma. Statistics show that skin cancer is the most common form of cancer in the United States. The two of which most common are basal cell carcinoma and squamous cell carcinoma. These two are highly curable, but they can be disfiguring and cost intensive in terms of treatment. So not too cost friendly. So as you can see in the diagram, basal cell carcinoma begins in the basal cell layer of the skin, which is located right below the squamous cell layer, which is where squamous cell carcinoma begins. And then melanoma, on the other hand, begins in the melanocytes, which are the cells that make melanin. Melanin is the pigment that gives our skin color. Melanoma is the third most common skin cancer behind basal and squamous cell carcinomas. And melanoma is the most dangerous and causes the most deaths out of all the skin cancers. So the majority of these three types of skin cancer are caused by overexposure to ultraviolet light or UV light. UV rays are an invisible kind of radiation that comes from the sun, tanning beds, and sun lamps. UV rays can penetrate and change skin cells. In addition to causing sunburn, too much exposure to UV rays can change skin texture. It causes the skin to age prematurely and can lead to skin cancer, which again is not good. UV rays also have been linked to eye conditions such as cataracts, which is also not good, but I won't be covering that today. So because of this UV lighting and rays, we have sunscreen. Sunscreen protects our skin either physically by deflecting UV rays with an inorganic blocker such as zinc oxide or titanium dioxide, or chemically by using carbon-based compounds to absorb UV photons that are then harmlessly dissipated as heat. We saw this in our previous lecture called Sunscreen and the Ocean, which is where I got this GIF from. So SPF 15 does a good job by blocking 93% of UVB rays, and this percentage goes up as SPF increases. So the more SPF, the more percent protection against UVB rays. So also, the choice in sunscreen that we make makes a difference. It has an impact on ocean organisms and marine life like coral reefs, also, which is what we learned from that lecture. The sunscreen choice contributes to a stress condition called coral bleaching in corals, which are living creatures, these corals. Exposure to specific sunscreens with organic compounds such as oxybenzone results in the death of the coral symbiotic algae. And the algae serves to provide the coral reefs with a reliable food source, which obviously the coral reefs need to survive. So yeah, these chemical-based sunscreen kills off algae that live on the coral reefs, which result in the bleaching of the coral reefs, which is not good, again. So some signs and symptoms of skin cancer include an unusual skin growth or sore that just doesn't go away, as relentless with time, and this may be the first indication of a non-melanoma skin cancer. Skin cancer may initially appear as a small irregular patch on the surface of the skin. These spots may be raised and may ooze or bleed easily if picked at. So as the cancer grows, the size or shape of the visible skin mass may change, and the cancer may grow into deeper layers of the skin, as shown in this diagram here. It may be difficult to differentiate one form of skin cancer from another, such as differentiating from basal cell carcinoma to melanoma. Can't really differentiate that. It's hard to, at least. So if you see any signs and symptoms, you should just consult a dermatologist straight away if you notice any. So, yeah. So the signs and symptoms of basal cell carcinomas and squamous cell carcinomas can be differentiated, on the other hand. Basal cell carcinomas on the head or neck may first appear as a pale patch of skin or a waxy translucent bump. You may see blood vessels even, or an indentation in the center of the bump. And I'm going to show you a picture on the next slide. But if the carcinoma develops on the chest for the basal cell, it may look more like a brownish scar or a flesh-colored lesion. As the cancer develops, it may bleed if injured or ooze and become crusty in some areas. So squamous cell carcinoma, on the other hand, may also develop as a lump on the skin, but these lumps are much more firm and typically more rough on the surface than basal cell carcinomas. If a lump doesn't form, on the other hand, on the squamous cell carcinomas, the cancer may develop a more reddish, scaly patch. Unlike a skin rash that goes away with time, these rough, scaly, lesion-like patches continue to develop slowly. This type of skin cancer is typically found on the head, neck, hands, or arms, but they can also develop in other areas as well. So this is a diagram. Like I said, basal cell carcinoma is more like a pale patch of skin or waxy translucent bump, whereas squamous cell carcinoma is more rough and reddish and like scaly kind of. So this is how you tell the difference between these two. So screening, self-examinations. So in order to alleviate the high costs of using screening devices and technology, a patient's prior knowledge on how to indicate and recognize early signs of skin cancer and early signs and symptoms of skin cancer may be helpful in not only recognizing the cancer in the early stages, but also treat it when it's not as developed and not as severe. So, yeah. Screening computer-aided. So using computer-aided detection may also benefit patients and doctors to identify a disease with a higher level of accuracy. Although it's more expensive than self-checking, obviously, the screening patients via computer imaging system allows physicians to acquire more information and data so that future diagnoses can be improved through gathered intelligence. Patients may also see benefit in more rural areas where physicians are not as readily available. So that's where technology comes in handy. And then lastly, screening via physician. A study showed that screening by a physician may be more beneficial by providing increased peace of mind, right? So a study showed that people who believed they were thoroughly screened by a well-trained practitioner scored higher on measure of positive psychosocial well-being than others. And I wrote this in my essay I was due earlier. Furthermore, the patients who were satisfied with their screening were also more motivated to regularly check their skin more often and thoroughly. So, yeah, the patients who had positive feedback also wanted to maintain their good health because the screening encouraged them so much to do so. So it kept them in check, essentially, themselves. So, yep. And that's it. Thank you.